Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you so much for joining us. I'm going to be speaking with Scott Storrer this morning, CEO of Affinity Empowering, and also Dr. Michael Tkach, Chief Operating Officer and Chief Behavioral Health Officer at Affinity Empowering. They're joining us to talk about the launch of the COVID clinic around the country. Now, Affinity is partnering with retail stores nationwide, placing 20-foot by 8-foot full-service COVID support stations in parking lots within local communities. These sites offer rapid testing as well as gold standard PCR testing, all of which is coordinated through Affinity's integrated tech platform. Thank you so much for joining us here on Health Professional Radio, both Scott Storrer and Dr. Michael Tkach.
Thank you.
Thank you very much for having us.
Scott, if you would give us a little bit of your professional background and talk briefly about your role there, as I said, as CEO of Affinity, and Michael, if you would do the same.
Yeah, just real quick. And again, thank you for having us. My name is Scott Storrer, and I lead Affinity Empowering. I've been with the company roughly 6 years now. However, prior to that, I've spent about 3/4 of my career leading large healthcare organizations in the payer space and also in the what I call broader healthcare supply chain space. And then from there, have spent some time in diagnostics, and then most recently over the past 6 years with Affinity.
Yeah, hi, I'm Dr. Michael Tkach, and I've been with Affinity for a little over a year and a half now. For overall my career, it's been split between doing operations for major companies as well as doing clinical work in psychology. I'm a licensed psychologist as well by training, and came to Affinity really to bridge those two to look at how I can go ahead and help Affinity, which was already doing phenomenal work in the wellness and mental health area, and really bolster that up and make sure that we're being conscious of our mental health initiatives when providing services. So I'm the Chief Operating Officer and the Chief Behavioral Health Officer for Affinity.
Well, Scott, Affinity has significant experience providing occupational healthcare services. How did you leverage that experience when you launched your COVID-19 Return to Work, Stay at Work program?
So Affinity, we have been providing occupational health services on a private pay basis for large employers for now almost 15 plus years. And the business model that we operate on behalf of our employers is essentially if one of their employees requires a service, whether it's a vaccination or a titer test or any type of fit for duty test, we have across the country on a captive network, Affinity Network, roughly 16,000 walk-in clinics where we can schedule employees on behalf of their employer to go and have tests. And all of those clinics are electronically connected into Affinity. And so once those tests are resulted, those results come through our technologies. Our medical staff and nurse case managers review the outcomes of the exams, and then we forward that back to the employer and also the employee. So when COVID broke back in March, one of our largest customers, Coca-Cola, reached out to us to essentially perform COVID testing for them. And if you think about it, the business model that I just described was perfectly set for COVID with two slight differences. One, rather than sending an employee to a bricks and mortar walk-in clinic for a COVID test, we actually had to show up on site on the premise of the employer and set up what we would call a pop-up clinic, where we would staff it with nurses who would handle the COVID collections. And then the other thing we had to do, because back in the time of March and April, the large reference labs that we were fully integrated with, Quest, LabCorp, and so forth, they were running turnaround times in days, 14, 15 days. And so what we did is we did a slight pivot. And as more and more labs were receiving their EUA approval from the FDA to do COVID testing, we essentially picked 25 of the best across the country and contracted with them for under 24-hour turnaround time of COVID tests and fully integrated. And here we are today. We manage thousands of COVID tests a day in the model I just described. And we're averaging about 16-hour average turnaround time from point of collection to when the results are returned to the individual.
That's outstanding. Michael, your program also focuses on the mental health issues related to COVID-19 and returning to a workplace during this pandemic. Talk about why this is part of the program.
Absolutely. When you think of something like a pandemic, there's a lot of anxiety that goes along with that. You have the workers that are worried about if they're going to be safe in the work environment, if they're going to catch COVID, or if they're going to bring it home and pass it on to their families. And there's this unseen aspect that really influences how people really approach work and their productivity. And we recognize that when approaching COVID and really thinking about it, it's more than just the physical health. There's that whole mental health side of it that goes along with it. And if we really are there to help support our employers and creating that safe workspace, then we have to have options for employers to elect to have these mental health focused initiatives to really create that level of comfort that employees are looking at for returning to work. So for us, it was just important for us to consider that. Additionally, when you start thinking about how somebody has an initial fear response to a situation, those types of behavioral changes that are initiated from that are typically short-lived. People will start kind of recognizing that overall, hey, maybe I'm not in as much danger as I thought. And so their adherence to these different types of behavioral changes and safety measures and hand washing and social distance and mask wearing tends to deviate, tends to shift. And so we wanted to make sure that we had a program that could also offer the ability to assess for when people are shifting back to their normal behaviors, when would be a good time to do a good intervention to say, hey, now's a good time for a refresher or retraining to make sure that people are staying compliant with your measures, all in the name of trying to make this as effective and as low anxiety producing for your employees and your workforce as possible.
And lots of resources developed toward that end, yeah?
Absolutely. So we have different ways that we can go ahead and run assessments so that we can kind of screen people. So we have our health risk assessments that look for symptoms like you typically would with COVID, or is there somebody running a temperature, or they have a cough, but there's also questions in there directly related to mental health. So, what's their anxiety level? Are they seeing people in their workplace going ahead and complying with these different measures that are happening? We thought about kind of just historically, you can look at and ask just an employer, how do you think you're doing with these? And most of the time, people will go ahead and they'll rate themselves favorably. So it's almost like you think about if you go to the dentist, not everybody flosses all the time, but almost everybody 2 weeks before starts flossing so that when they're sitting in that chair, they can say, things are going great, I'm flossing every day. It's that when you're put on the spot and you think that you're being evaluated, there's a tendency to over-evaluate yourself. So we wanted to use data and different ways to collect that information to say, okay, what's actually going on? When we're doing those assessments, let's pull that information in so that we can target those responses. And then let's provide resources in the form of articles, movie clips, or short, really consumable media clips that people can easily look at and have as reference points and activities that can help reduce workplace stress and anxiety.
Mm-hmm. All of this testing, the resources that have been talked about, it's all coordinated through your Assure app. Talk about this app, how it was developed and how it's integrated into the program.
Yes. So the Assure platform is a multi-generational technology platform that originally was developed with our work with government to help look at different initiatives with population management. And it evolved to also help us track mental health-related initiatives like people's adherence to substance use, treatment recovery for safety-sensitive employees. Like, for instance, if a medical doctor or nurse goes to recovery, often as a contingency for them to get their license back and continue to practice, they have to show that they're staying consistently on their recovery plan. And so the technology platform is really designed to do those kinds of things, look for compliance, then on top of that offer telehealth visits and other types of resources and ways to connect with people, as well as being able to track individual results over time. And so it became this phenomenal platform for us to gather a lot of information, to share a lot of information, and to do that in a HIPAA compliant, secure way for those individuals. So when we shifted to COVID testing, it was really easy when that evolution happened for us just to take those same types of advancements and apply it here. We can give people individual access that they can go through and review all their personal records and their results, as well as employers a separate portal so that they can do a quick scan of their workforce to see who's been cleared to return to work. Mm-hmm. What that platform then does is it gives us a great way to collect data with doing these assessments, aggregating that data so that we can go ahead and dashboard it and make it very usable. But the other thing it does is it gives everybody their unique login so that they can have immediate access to those mental health resources. Mm-hmm. A lot of companies will go ahead and have like an EAP program where they can go ahead and refer their employees to go get psychological testing. We know that those programs are phenomenal. However, there's always going to be a subset of the employee workforce that refrains from using them because they're afraid that if they go ahead and elect to participate in those programs, that somehow their employer is going to find out about it and it's going to flag them in a certain way, regardless of the fact that there are safety and privacy standards around that protects from that. And so what we decided to do is to remove a barrier of access is with the clients that have elected to have this part of their program, all of their employees have direct, immediate access when they log in to these mental health resources. So it's not something you have to elect to join in at the employee level. It's just available to everybody that participates. And our technology platform is already set up in a way that allows to push that information, that data, to really help target the individuals and support them in a way that meets their specific needs. And so that integration in this platform has been key to helping us be as effective and as efficient as possible. And what we see is that our companies that are using our overall COVID strategy, their typical positivity rate when they're doing kind of more regular testing is down at the 0.76% compared to the national average of where you see things around the 3 to 5%, which luckily is dropping from there, but it's much lower. And we also feel that those employees are being much more productive and engaged.
Scott, we're hearing a lot in the news about the supply of vaccinations expected to pick up in the coming months, accelerated production. Mm-hmm. Is Affinity planning to incorporate this increase into their ongoing platform or program and any future programs that are in the works?
Yes, absolutely. So, in 2020, we stuck to servicing our employers with COVID testing, and we stayed out of the direct-to-consumer space, which was highly crowded. We do believe in opening up work. We do believe, as Michael said, that it's best for an employee's behavioral health to be back at work. That was our focus in 2020. As we moved into 2021, what we found is a lot of these pop-up direct-to-consumer testing sites, whether they're in shopping malls or even CVS and Walgreens and some of the larger chains, they essentially are one by one dropping off. The volumes just simply are not there. However, what we are doing is we are going into those spaces with a high-quality COVID clinic, where we perform first and foremost direct-to-consumer PCR testing. But the plan is once we have access to the vaccine, we will absolutely begin to distribute vaccine in those same clinics. And then beyond that, we'll also be positioned to be doing antibody testing to check the efficacy of the vaccine and any type of future surveillance testing that may need to be done with various variants that are coming our way, unfortunately, with COVID.
Give us a website where our listeners can learn much more about Affinity.
Well, our listeners can go to the www.affinityreturntowork.com to learn more about our return to work strategies and stay at work strategies.
Well, I appreciate you both joining us here on Health Professional Radio this morning, both Scott Storrer and Michael Tkach. Thank you both for joining us.
Thank you.
Thank you very much for having us, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Scott Storrer, Chief Executive Officer at Affinity Empowering, and Dr. Michael Tkach, Chief Operating Officer and Chief Behavioral Health Officer at Affinity as well. Audio copies of this program are available at healthprofessionalradio.com.au, also at hbr.fm. You can also subscribe to our podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.